Dr. Kassler, welcome to the show.
Thank you. It's a pleasure to be here. Thanks for inviting me.
So you are working from home today, as we all are, most of us
Yeah.
around the country, and you've
In the,
had you're in a room that it's your office, but it until recently you haven't really focused on it as an office.
no, this is just one of the kids' bedrooms. We're empty nesters, and we had kind of junked it up a bit. We had boxes all around of kid stuff and some clothes we were going to donate. And I typically, when I use the office, have been signing in by telephone. And now with the new culture, I feel obligated to establish that connection, have a video, but that meant I had to do a fair amount of cleaning.
So I'm like a halfway to empty nest, but with COVID-19 and the self quarantine, I've got like suddenly kids back at home, and so that's one of our adjustments is we suddenly have a lot more people and
Yeah.
less space, and we're doing a lot more looking at each other than we're used to. So that's been an adjustment.
Yeah, so I have my youngest is a college senior, and he was on spring break at home, thankfully, not in Florida or any high volume place. And we got the notice: don't come back. No graduation. Don't come back. You'll do everything remotely. So, having been 4 years as an empty nester, it is an adjustment. But I'll tell you something, Jesse. As we try to look at the silver lining, as we try to frame things in the positive, it is a joy as well to have him home and safe and get to know him as an adult. So it's the new normal.
Yeah. So it's the new normal at IBM too. What does that look like these days? You've got a few 100,000 people globally, and what's going on there?
We have over 350,000 employees across the globe, and I just learned that more than 95% of IBMers are now working from home. So what a huge adjustment. We were a culture, we're a business to business company. So we had a culture of going to the clients, being on site. I used to joke that my office was seat 9A on American Airlines. Um, and that's no longer an option these days. So we are learning to do things through tech. We are learning to do things remotely. We are trying to connect socially with ourselves, with our clients, and like everyone else, we're trying to be resilient.
What's IBM been doing to help mitigate the sort of employee well-being concerns that are popping up? It's no secret everybody is talking about across the country how difficult and challenging these uncertain times are.
So one of the key focuses that IBM had prior to the pandemic was looking at mental health. Mental health is a huge issue, but it has been a hidden issue. Turns out that 1 in 5 Americans suffer from some form of mental health. That's 43 million adults. They bring that into the workplace. Workplaces can either make it better or make it worse. And so prior to the pandemic, IBM was working with a number of other companies to try to understand this, to try to reduce the stigma. Now along comes the pandemic. There's social distancing, there's isolation, there's stress. We are all worried about having to cope with the disruption in our lives, and fear of the pandemic in terms of catching the infection, worry about our loved ones. So that adds stress for folks who don't have mental health issues. So IBM has really been thinking about this a fair amount, and we're working. We can dive into some of the things that we're doing, but this is a key issue for us.
Yeah, I was thinking you mentioned silver lining earlier, and in terms of the stigma attached to mental health, it seems like one of the silver lining is I'm noticing, like on social media and elsewhere, people are just much more willing to talk about the emotional stuff. And so
Right.
if that obviously creates a healthier environment if I can say, it's not all good for me right now. I'm kind of feeling crappy, and and it's okay to talk about that.
I agree. And then there's the issue of stigma in mental health. When we think about us versus them, we can say, okay, well, people who have a mental health diagnosis, that's them, right? It turns out not to be, because it impacts so many of us and our families. But it's easier to stigmatize. When we're all in this together, when we're all stressed, I think it brings us together. And my real hope is that on the other side of the pandemic curve, that we can bring some of that inclusivity, that willingness to talk, and that we'll get the glow from that afterwards.
Yeah, that is interesting. Can we maintain the we're in this together? It's not your problem or my problem, but it's the human
Yeah,
journey. Yeah, we're all
yeah,
just trying to navigate life the best we can based on what we know today.
yeah.
Yeah, so let's dig into what are some of the things that IBM's doing?
So I'd like to kind of bifurcate this, if you will, into what people can do and how we can address people, and kind of programs and policies, if you will. So let's start about IBM as an employer, as programs and policies. But I hope we can circle around to talk about what individuals can do and what we're urging individuals to do for self-care.
Sounds great.
But in terms of an approach, I tend to think about this as assess, triage, and refer, and implement. So, assessing, we are looking at what our capabilities are as an organization, what our policies, our programs, how are we able to serve our employees in this important area. Um, there are resources out there, that the American Heart Association, for example, has come up with a workplace health assessment index, that is a self tool for employers to look at how well we are doing against best practices and evidence based practices. The Centers for Disease and Control and Prevention, that we're now thinking about as infectious disease pandemic advice, they also have information around mental health and what companies can be doing. So part of that is a self-assessment. Part of that then is an ability to take and have individuals come to us and assess themselves as well as individuals. But getting back to the programs and policies, once we assess that, we can provide um, employee assistance program. We can offer tools and counseling and referrals to services. There are mHealth apps, and I hope we can dive into the technology as well, because we are a tech. But we have apps that we can use. We have to train our our managers, our leadership, in terms of um, how to be sensitive, how to destigmatize, how to be inclusive around mental health, um, and how to make our workplace less toxic, if you will. I think that's a question that we all should make. How can we, as employers, um, make our workplace helpful and not harmful when it comes to mental health?
Even to ask that question, it's such a vulnerable question. Most employers would not even be willing to go there because, well, of course we're not toxic. We do everything fine. And uh, I'm sure a lot of attorneys might say you shouldn't even be saying that out loud to suggest that there might be some toxicity. We're gonna have some litigation coming out of that.
I think we have to own it. We all have to own it. We have to have a culture of improvement, of self-reflection, and of growth.
I love it. Yeah, that's good. So, do you already have? Are you getting any data in terms of utilization of things like EAP? Are employees actually using those programs at a higher level now so far?
So I don't, but that's not my role at IBM. We have a medical officer that implements these. that tracks them, that does them. We are a very data driven company. I just can't share them with you now because that's just not what I do, my role within the company. But I would like to pivot and continue the last question by saying that another way in which companies can really make a difference in terms of the health care that we purchase for our employees. It's called value-based insurance design, but we companies have a fair amount of influence in terms of the access to and the quality of the health care that our employees receive as a benefit. So we can make a difference in terms of making sure that the health plans that we purchase and the options that our employees have robust mental health services on a par with the quality and the access for physical health services. So huge policy issue in addition to the programmatic issues.
You're right. That's often just been an afterthought, just a carve out or just something that most companies don't think about at all, and because most employees don't maybe think about it or talk about it, so it hasn't seemed like a valuable offering, and probably the coronavirus pandemic is bringing to light the greater importance, and I think employees will start seeing like that. I'm proud that my company has a robust offering, not just for physical health but for mental well-being as well.
Exactly.
Where do you want to go next? Do you have more to dive into
Well,
there?
sure. Let's talk about mental health and individuals. One of my roles in the company, I do office hours. When we and this is just post pandemic. I hadn't done this prior. But this idea that all of our employees are now disparate, they're worrying about themselves, they're worrying about their families, and then they have the added stress. I mean, I talked trivially about having to clean up my office, but for single parents or for two working parents that have kids at home that are toddlers or in school, the added stress of then having to be a homeschooler, of having the kids running through the office as they're talking. Um, so post pandemic, I've opened up office hours and I've tried to think about and share ways in which individuals can reduce their stress. And I make 3 points. Um, the first is fear, the second resilience, and the third is self care. So fear is an evolutionary response to danger. It alerts us, pay attention, there's something out there that can harm you. Our animal brain then has a fight or flight. We have that adrenaline surge. Mostly we run away, but once that adrenaline surge is over, we're done. Our human brain, though, more complex, we create a plan. We assess the danger, we create a plan, and we implement that plan. After we do that, the fear is no longer helpful and it can actually be harmful. To have that sustained adrenaline response, that sustained fear, can lower our performance and cause physiologic harm. So, understanding that can help us to achieve a new equilibrium. And that's what resilience is about. So, resilience is our ability to bounce back and recover from trauma and adapt and achieve that new equilibrium. It's not that the trauma and the adverse circumstances don't hurt, they aren't stressful, but our ability to cope and to bounce back is resilience. Resilience is not a trait or something that's inherited. Resilience is a skill that can be learned and developed like a muscle. So there are certain things that can do that. And that brings me to my third point, which is self care. So self care are ways in which we can build resilience. Like when we used to fly, and they would, that announcement, when the mask comes down, put it on yourself first
Right.
before helping others. We can't help others. We can't do a good job at work, in our families, unless we take care of ourselves. So hobbies, doing things that we like, carving out that time to achieve some normality, making sure we eat right, we sleep right, we have physical activity as part of our daily routine. We talked earlier about framing things in the positive. So this is very stressful, but there are things to be grateful for. Um, Having our kids home and safe, being able to maybe carve a little bit of time out to appreciate a sunny day or a bird, the beauty in life, and then making sure that we have purpose in our lives. So having a meaningful accomplishment, be that doing something at work, something around the house, helping someone else, but having that sense of purpose. And lastly, just finding something to be grateful for. So those are all things that we can help to achieve resilience.
So, fear, resilience, and self care. Um, Tell me a little bit more about fear in terms of, is that when you mention that topic, is that for people just to have some awareness, like, hey, let's just notice the fear and not try to ignore it or get too caught up in it?
So if we understand that that fear and anxiety can be mitigated by having a plan, by acting on that plan, by knowing, okay, I've got enough food for 2 weeks. That's what they're telling me I need. So I don't have to worry about that. I don't have to, when I go to the grocery store and see the empty shelves, I don't, you get caught up. We're social beings. You get, even though we know I have enough toilet paper, it's like, oh God, I can't find it. So we do get caught up. I'm a news junkie. I have to pull myself away from reading about COVID because even as a physician and an epidemiologist and a CDC trained infectious disease epidemiologist, I can sometimes get caught up in this. So I have to remind myself I have a plan. I'm acting on that. Continuing to assess the risk. The fear and anxiety don't help.
Yeah, I think it's also helpful. I'm really, what you're saying is resonating with me, and then I'm also kind of remembering a lot of the anxiety that I've felt through the COVID crisis.
Mhm.
In creating a plan and following the plan is also this aspect of serenity and just recognizing there are
Mhm.
just some things that are out of my control, and I can only
Right.
control so much, and I've got to sort of surrender the rest. And I
Right.
can only do one thing at a time. Like, I have limits. I can't go do everything today. And it's hard to focus on one thing at a
Right.
time. So it's sort of recognizing the human limits of the plan is been helpful.
So I'm an internist. I'm not a psychologist or a psychiatrist, but there's a fair amount of mental health in every primary care practice: depression, anxiety. One of the most effective non-pharmaceutical interventions is behavioral cognitive therapy, and for people with anxiety or depression, and also for people who don't have those conditions but are stressed as well. You can rewire the brain by framing things in the positive, by having that self-talk, by continually reminding ourselves, fear is the enemy. I've got my plan. I'm acting on it. Think about the happy place. Be grateful. Do the self-care. Those are the things that trained counselors will work on for people who bring a mental health challenge to the table, and they'll work for those of us who don't have those challenges as well.
Is this a good time to talk about some of the mental health apps or the technology that's available?
Uh, Absolutely.
Okay.
Um, so, one of the challenges um, for treating mental health in this country pre pandemic, which is exacerbated post pandemic, are, are stigma and access. There just aren't enough mental health providers to go around. People are not necessarily willing to go to a mental health provider. Maybe their primary care docs or their family don't recognize it, don't tell them to go there. But it turns out that 60% of people who are diagnosed with a mental health illness do not get treatment for that. So that's a huge issue. Um, Technology can help. One of the ways technology can help is through sort of remote access. So apps are one good way. There are some online uh, services that we can talk about. as well, and remote and telehealth. But let's start with the apps. Many people, even if they don't embrace technology, will have that smartphone available, including uh, uh, the elderly and even folks who are in come from disadvantaged circumstances. Cell phones have really proliferated. As a result, there is a wide range of apps out there, health apps and mental health apps. I call it the wild, wild west. There's the good, the bad, and the ugly. And what IBM found in its recent report on mental health and technology, the Institute for Business Value report, was that we need, as companies, to be recommending curated apps. As physicians and healthcare providers, we need to be recommending curated apps. Those apps need to be evidence based. They need to have security and privacy and science behind them. And there are those apps. Um, One of those apps is called Grit. Grit is an IBM app that was targeted to veterans with post traumatic stress disorder. It is a platform which can do, remember, I talked earlier about assessment, triage, referral to services. So, at its core, it's a self assessment. Veterans can answer questions. Turns out that one of the advantages of these apps is that people will answer stigmatizing questions to an anonymous computer easier than face to face to a trusted counselor. So the app then will ask a series of questions, will personalize a care plan, will provide some mental exercises. We call it a mind gym to help people around relaxation and recovery and a number of other things based on their personal, how they answer the questions. But then it turns out that one of the key stresses that veterans have coming back are jobs. That unemployment is high in this. So we partnered with an employment agency, Burning Glass, 51,000 apps. They can assess the app, 50,000 rather jobs. The app can assess the skills, go out electronically and match to jobs, and we're now getting tens of thousands of vets jobs as a result of that. So that's one example. Another really interesting example is the use of artificial intelligence. There's a company called Teatros that has an online counseling platform. Rather than an app, everybody comes anonymously and confidentially to a group counseling session using some of these behavioral cognitive therapies. And the AI will listen to and watch what they write with informed consent, mind you. This is not spying, this is consent. Um, they'll assess sentiment, mood, personality. And just as a counselor is using psychological instruments, the AI is using conversational AI instruments. And they're giving counselors personalized views more than the standard psychiatric assessments to help the counselors personalize that information. That's called Teatros.
Can you spell that for us?
Tiatros.
Gotcha. I was close.
Yeah.
So is
And,
that?
and,
Go ahead.
no, I was just going to wrap it up and say those are two examples of the use of curated, science-based, evidence-based technology that can help.
Yeah, that's really interesting. One thing I'm curious about regarding grit is you mentioned it's targeted to veterans, and of
Mhm,
course PTSD is um, it can happen from any type of trauma, not just war trauma.
mhm.
Is that also suitable for other types of people than other than vets, or are there similar apps that you'd recommend for someone with other types of trauma?
So IBM has just rolled out Grit, and it is targeted to veterans. Specifically, the assessments are targeted to veterans, and the services are targeted. Veterans can also bring in squad members of their former squad to do social and peer counseling. The Grit team has released an app for the pandemic that is just one piece of that, which is they call it the Mind Gym, but it is the stress reduction app. So that was rolled out very quickly to take that one piece of it to make that more broadly accessible. I don't think they're charging anything for that during the pandemic. And I think that the development team is going to be considering how can the Grit technology be used more broadly. The Teatros team, while they started for vets, for women who had military sexual trauma, and for combat vets that had PTSD, they have adapted that for use by employers, and they're working with the American Heart Association to add that to resilience training for post cardiac arrest for rehab. So that I think we're in the early phases of this innovation journey, and we're going to be seeing more of this, more use cases. But right now, those technologies that I think are based on science and based on evidence, they're going slow. They're getting evidence to show the effectiveness, the safety of that. And so I think it's going to be a slow curve of innovation.
Yeah. Now, you mentioned, in addition to some apps, that there were some online services that have been that are recommended too. Would you like to talk about some of those?
I think the Teatros was the online
Okay,
service, the Group was the app. Those are two really good examples.
gotcha. Okay. And are there any, before we kind of move on, are there any other apps or online services that you'd like to talk about?
I think those are going to be ones we can provide you a curated list of some of the ones that we're familiar with, but I think those are the ones that I kind of like to leave as two really good examples of both an app and an online service.
Yeah,
I think there's one that we offer for our employees. I'm not really prepared to talk about it in detail. I think it's called M Equilibrium, but I'm not sure on that. But that's another one that IBM has curated for its employees as well.
that one I'm familiar with, and I'm trying to, because it's actually been featured on our podcast,
Oh,
and I'm
great.
embarrassed to say I can't remember if it's M Equilibrium or like M Equilibrium, something like that. But I will, I'll get that sorted out and put it in our show notes for this.
And we'll share you some more as well if you like.
Yeah, terrific, terrific. Um, are there any other tips or advice that company leaders might find helpful to know in helping employees deal with the pandemic?
I think there's an old strategy that says, or I'm sorry, there's an old quote that says, culture beats strategy every time, or culture eats strategy for lunch, or something along that line. But it's easy to get into, all right, here are the programs, here are the policies in place, and a list of strategic things to do. But it's been my experience in healthcare that it's creating the culture that is the hardest thing to do, but that is probably the most important thing to do. And culture comes from the top. It's set from the top. It's an investment that leaders have in people. It's creating the infrastructure that allows all of the programs and policies. It means holding people accountable for their behavior. Um, and, um, uh, and I think everything comes from a culture of um, acceptance, of welcoming diversity, of reducing stigmatization, and it's something that everybody, from the leaders and the managers down to the frontline employees, need to embrace and be held accountable for.
Where can people find out more about you, maybe follow what you're doing or what IBM is doing?
IBM has a robust website. I would urge people to go on to the website and search. We have our IBV reports, We have one that just came out a few weeks ago on mental health and technology. We have another one on social isolation and aging. I'm available on LinkedIn, William Kassler, and I don't have a robust social media presence, but I'm learning. I'm being dragged, kicking and screaming into this, which is kind of ironic for a tech guy. But um, it is what it is.
Yeah, for those who are listening, I did follow you on Twitter, so if folks want to grab you on Twitter, that your handle is Kassler MD, Kassler with a K.
Yeah. Um, and so I'm more engaged on LinkedIn, but I do vary, and I probably ought to pay more attention to Twitter as well. But that's a good reminder that in this day and age of social distancing, social media is hugely important. I like to say, the epidemiologists call it social distancing. I like to say it's physical distancing. Just because we're physically distanced doesn't mean we have to be socially distant.
I like that. I have been trying to remind people just because we need to have social distancing doesn't mean we need to be isolated,
Yeah.
socially isolated. But I like the way you said that. It's physical distancing. It doesn't have to be. How did you say that one more time?
Just because we're practicing physical distancing doesn't mean we have to be socially distant.
I like that. That's really helpful. Any final words before we wrap up?
Thank you. Thank you for inviting me onto the show. Thank you for this great and stimulating conversation and for the opportunity to share something that I'm passionate about, which is public health and technology, particularly in service of mental health.